Hi everyone, my name is Lillian Klein, and today I'm going to be discussing Assembly Bill 54. First off, what is AB-54? AB-54 aims to protect and expand access to abortion, including later stages of pregnancy, by removing specific gestational limits and broadly defining exceptions related to the health of the pregnant woman. This policy can affect patients, healthcare providers, and legal institutions. We're probably wondering what's so bad about that. Problems with late-term abortions can include health risks that are both to the mother and to the baby, and moral and ethical dilemmas, including fetal viability, personhood, and brutality. So what? Some questions that we should dwell on regarding AB 54 and late-term abortions is what defines life? Does the ability of the fetus to survive independently give it a right to life? When is personhood? Should a late-term baby have moral or legal rights? And how do those balance against the rights of a mother? And then how are late-term abortions bad? What is so bad about them? So now let's figure out what are exactly late-term abortions and what is wrong with them. There are two different kinds of late-term abortions or third trimester abortions. There are the induction abortions, where the pregnant mother is given medications to induce labor and delivery. Often an injection is administered beforehand into the mother's stomach to ensure the baby has died before the delivery. There is also dilation and extermination, also called DNX or DNE, where the cervix is gradually dilated over a couple of days, and then surgical instruments such as clamps and vacuums and other things are used to remove the baby either as a whole or in parts. If you want to learn more about abortion procedures in depth and exactly what they are, you can go to liveaction.org or visit LiveAction's YouTube page and search for abortion procedures. Now, regarding the question, why are third trimester abortions wrong? They're wrong because they involve ending a life at a stage when the baby is viable outside of the womb and has developed so many human features, including the ability to feel pain and respond to stimuli. Deliberately ending such a life undermines the value of human life. There are also concerns about emotional and psychological impact on all involved, including the mother and the medical providers. For these reasons, abortion should never be an option, let alone third trimester abortions. So what are the alternatives to late-term abortions? If the woman does not want the child, she can pursue carrying the baby to term and giving the baby to a loving family who wants to take care of that baby. If there are medical reasons the pregnancy is putting the mother's life at risk, a cesarean section or C-section would suffice because most children at that age are viable and have the ability to survive outside of the womb. In conclusion, Assembly Bill 54 and the broader issue of late-term abortions raise complex moral, medical, and legal questions. While some see the bill as a way to protect reproductive rights, everyone should be deeply concerned about the ethical implications of ending the life of a viable baby in the third trimester. As these debates continue, it's essential to consider both the rights of the mother and the child, as well as the moral status of the baby. Now is the time to stay informed, engage in respectful dialogue, and advocate for the compassionate, balanced policies that protect life and support those facing difficult decisions. Lastly, what can you do regarding this topic? There are so many different ways that you can help. You can donate resources to local pregnancy centers, donate funds to pro-life organizations who are making a difference. You can support mothers in difficult times. You can join sidewalk teams to show those mothers that they have support. You can have peaceful conversations. And most importantly, be bold.